So my goal today is to talk a little bit about healthcare management and some healthcare management careers. I'm going to start by talking a little bit about myself, not because I think I'm such an interesting person, but I'm going to talk a little bit about how I got from where I was to where I am. And then lastly, what I want to do is to try to echo to you how you can pay attention to bends in the roads of your life and think about how you can move forward into the future. So my career, as I was introduced, I am the president of Arnot Ogden Medical Center in St. Joseph's Hospital. It's not a career that I ever started out to strive towards, but I find myself there today, and I'm really excited about the opportunities that are presented to us in healthcare today. So I'm going to talk a little bit about how I did get to be president of Arnot Ogden Medical Center in St. Joseph's Hospital, because it was a really windy road. Any of you ever been to the top of Pikes Peak? You know, you can't get there straight up. You have to wind the roads. I spent a lot of my life winding those roads. Started my life in Pittsburgh, Pennsylvania. You know, it's kind of interesting because when most people think of Pittsburgh, this is the image that they have. But growing up in Pittsburgh, this is the Pittsburgh that I knew. Cold winters, houses cramped together. But we also knew about was Pittsburgh Steelers. And the Steelers committed to hard work and a winning record. So I was glad to see this whole thing about robots, because I kind of had a robot going in my presentation, because today, you know, you have some heroes. I just recently went to see Iron Man 3. You know, a lot of people see him as his hero. Well, this is me and my hero. This picture actually is a gift of my mother to my youngest daughter, who then hacked my Facebook account and placed that picture as my picture on my Facebook account. I didn't know that picture existed until just a few years ago. Not only did I get to see the picture, I also got a lecture from my daughter. I had to take care of my security on my Facebook account. But my hero was this guy, Davy Crockett. So most of you probably know Iron Man. How many of you know Davy Crockett? So Davy Crockett was what? He was the king of the wild frontier. Well, growing up in Pittsburgh, thinking about the wild frontier really brought some new things to me. So Davy Crockett set out to find new ways, new paths. And when he would get to a path, he would take it. And so I decided to do the same thing. Now, my dad thought I was actually kind of, couldn't make up my mind what to do. You know, I just kind of flipped from one school to another. You heard about me going to Thiel College, small Lutheran liberal arts college in Western Pennsylvania. In those days, I was actually studying animal behavior. I then went on to nursing school after a stint in the Army. I then went to West Virginia University. It wasn't on the information I provided, but I actually studied animal behavior. I taught animal behavior at West Virginia University for a period of time. And then ultimately went on to Binghamton University, where I got my doctorate. I actually did that, I think, to confuse people, because I'm actually a registered nurse. Dr. Fred Farley is a registered nurse. That tends to get kind of confusing for people. Well, when I started my career, I actually wanted to study animal behavior. I had this great thought. You know, back in the late 60s, early 70s, Shamu was just making his way onto the stages across the country. And I thought, wouldn't it be great to be the next trainer of Shamu the whale? And I actually went away to school to become Shamu the whale trainer. Well, guess how many Shamu the whale trainers there are in the country? Not very many. And so the job opportunities weren't all that great. So I decided to go off to nursing school. And I didn't go off to nursing school to become a practicing nurse. I went off to nursing school because I saw it as a career path to help me move into teaching, something that I had always enjoyed doing. But something that really surprised me, I actually very much liked being at the bedside. One of my early mentors had told me that, you know, you can have an impact on a few people by being an independent or a private practice or practicing nursing at a hospital. Or you can have an impact on a large group of people, taking care of a large group of patients, if you would move into a leadership position. Now, that person actually thought a leadership position would be one in which I would actually be teaching. I actually had a little bit different bent on that because of a person that I had met, a guy named Mr. Applebaum. Mr. Applebaum was a gentleman who, at the time, I was 30. Mr. Applebaum was 40. Mr. Applebaum had a very severe heart attack. Mr. Applebaum's heart attack actually, you saw the pictures of the heart earlier. Mr. Applebaum's heart attack actually destroyed the bottom of his heart. And at the time, we had something relatively new. It was known as an inner aortic balloon pump. We had the ability to actually put an assistive device into the patient. And that assisted device could keep the patient alive, but not very long. And so we were waiting for Mr. Applebaum to actually get a heart transplant. The unfortunate thing for Mr. Applebaum was that the heart transplant could not happen soon enough. But the one thing that I learned from Mr. Applebaum in the several weeks that we took care of him was that he started to live every day as though that was going to be the last day in his life. He became more goal-directed than he had ever been before. And that left a real lifelong impression upon me. Stay goal-directed. So I made a decision at that point in time that I was going to move into healthcare administration. Now, if you look up a definition of healthcare administration, this is actually what you'll find. So healthcare administration involves the overall management and the leadership of the healthcare organization to try to ensure that optimal care is able to be provided. But something has become even more important. We have to be able to provide that care in a patient-friendly fashion, but we also have to do it in a way in which we can control the cost of healthcare services. Something that's really great about careers in healthcare, especially for healthcare managers, there are lots of different avenues in which you can use to move into healthcare. It can be through direct clinical services, and lots of people move into management positions because they started out as a registered nurse or a radiation therapist. Even many physicians now are moving into leadership positions. In healthcare, there also are a lot of support positions. You know, when you're thinking about working in a hospital, most people, when they think of providing healthcare services, they think about that in a hospital environment. Actually, today, more healthcare is actually provided outside the hospital than inside the hospital. But in those positions, there are a lot of what are considered direct support positions. In a hospital, we have to keep the physical plant going. People need to take care of the maintenance, the environmental services, food services. Something that's becoming increasingly important is information technology. We have to take care of human resources. Arnot Medical Center, St. Joseph's Hospital, employs 3,000 people, a lot of human resource activity. You need to know about healthcare law and healthcare ethics. You need to know about marketing, public relations. You also need to know how to manage statistics and epidemiology. When we think about healthcare roles, what we tend to think about is hospitals, because historically, that's where most healthcare was provided. But healthcare has moved into an ambulatory environment very rapidly. And so now more healthcare is actually provided outside the hospital than inside the hospital. And there are places like nursing homes, residential healthcare facilities, home health agencies, public health agencies, community clinics, and lots of professional practices. And each one of those locations have to have managers to make sure that the highest quality, most cost-effective services are being provided. So this is really an exciting time for people to consider a healthcare career. Lots of changes. You probably have heard about what's referred to as Obamacare or the Affordable Care Act. Our system is about to be turned upside down from how it has been historically. And one of the things about the U.S. healthcare system is that we have considered the U.S. healthcare system as being the best in the world for a long period of time. But the dilemma is we spend twice as much on healthcare in this country than is spent in any other developed country in the world. Yet when you look at the World Healthcare Organization metrics that are used to measure the effectiveness of the healthcare institution, we actually are in the middle of the pack. So we're spending twice as much, but our healthcare outcomes put us about in the middle of the pack of developed countries. We need to do something very different about that. Now, the Affordable Care Act is going to make lots of people who currently don't have insurance access to health care. It's going to be providing access to those services. And we need to be able to make sure that we're building an infrastructure, we have an ability to take care of those patients as more and more patients moving to the future are seeking health care. One of the things that we think about when we think about the U.S. healthcare system is that we call it a healthcare system, but historically we actually haven't had a healthcare system in this country. What we've had is an illness system. We wait until people get sick, and then we find lots of ways to try to make them better. We develop lots of technology, implantable devices. We look for ways to more efficiently and effectively replace knees and hips and arms. We're helping people find ways to take care of their diabetes, helping them take care of their hypertension, often which is a result of inactivity and being obese, not taking care of yourself physically. So we're right now at a major junction in this country, and you're starting to hear a whole lot more about actually moving us to a healthcare system and away from an illness system. So that makes it an exciting time for people that work in the healthcare environment. So the issue for us has to become, we need to become much more focused on wellness. And we need to move away from this mindset of thinking that we're only going to take care of people when they become ill. The other thing that's becoming a major challenge in this country is that people are living longer and longer. We have lots of people referred to those baby boomers, people my age, who are headed towards retirement. More than ever before, those baby boomers are going to be seeking healthcare services because they're expecting to live higher quality lives longer than what their parents did. And so the healthcare system has to be prepared to be able to help us do that. And to be able to do that, we need to focus on making sure that there is access to care by patients without regard of their ability to pay, without regard to their location in the country. That's much more difficult in rural communities, places like Elmira, than it is in a community like New York City where you have lots of resources available to you. The other thing that's becoming extremely important is that we have to become much more focused on providing high quality services. The healthcare system is kind of interesting in that if you were going to go out and you were going to buy a new car, most people right now, they actually go to the internet. They'll be able to find out lots of information about their car. You know, how fast will the car go? What's the repair record for the car? What is the repair record for the dealer they're going to buy the car from? Do they take good care of their customers? All that information is available to you on the internet. You can find lots of information about how much that car should cost you. Don't pay attention to the sticker price. How much when I go in and try to negotiate a price for that car? How much am I going to have to pay? Well, you know, all that same information is actually available for healthcare services. But how many people actually go to the internet and try to find out information about the healthcare services before they select the services that they're going to receive? That happens very rarely. But we need to make sure that that starts to change. People should be thinking about making sure that they're getting services from the highest quality providers in the most cost-effective fashion. The other thing that's a little bit of a disconnect for providing healthcare in this country is that almost everyone who has insurance pays a small amount for the services that they are provided. And as a result of that, you're not really driven to buying value-driven services. If you have to pay for everything out of your pocket, you want to know what the price is before you go out to buy it. Well, the healthcare system isn't set up that way. First of all, it's hard to find out how much a service might cost, and it's even harder to try to shop the value-added services between providers. What we need to do is to make it easier for people to identify the true cost of the services you're providing and put that in the context of the quality of the service that's being provided. When we talk about quality, there's two types of quality. One of those is clinical quality. Now, when you go to a hospital in the United States, you go to a doctor's office, you actually expect to get the highest quality services. You expect the people that are providing services to you to be well-trained, have the latest equipment, to be able to diagnose whatever the problem is that you have and take the right steps to make sure that your ailment is being taken care of. But historically, we haven't done that in a very customer-friendly fashion. And now what's becoming increasingly important is that we actually find ways to provide patient services in a very customer-friendly fashion. And that's going to become a major challenge for healthcare administrators to make sure that we're able to provide high-quality services. We're doing that in an affordable fashion, but we're also doing it in a way that patients receive a high level of satisfaction from the services that they receive. So the last thing I would speak to about this career is that it's an enormous opportunity right now for career expansion. And that's a function of a couple things. One is that I was talking about those baby boomers. Lots of people in healthcare are headed towards the end of their career. And in the next 10 years, there's going to be an enormous amount of turnover in people who provide services, both the clinical services as well as the administrative services in healthcare. And so we will have access to lots of jobs in the healthcare arena. The Bureau of Labor Statistics also estimates that there's going to be an actual growth in healthcare careers, specifically for healthcare managers, over the course of the next 10 years. And that's a function of an increasing population gaining access to healthcare services. So the healthcare career outlook is very positive. So a few parting thoughts for you. It is really essential that you remain committed, that you find ways to put your efforts forward in a positive direction, that you remain loyal, not loyal to organizations, not loyal to any entities, but loyal to yourself, so that you're sure that as you set directions, that you keep moving forward with those directions. And keep in mind that you can, in fact, control your destination. Much like my career path started thinking that I would be a person taking care of Shamu, and now I find myself in a healthcare career in very different directions. So what I wanted to leave you with is that my path was kind of a windy path up a hill, always focused on an indirection. The dilemma that I think that many youth will experience today is I think your path is going to be more like this labyrinth. And the labyrinth has some paths straight through, and some paths are going to have blockades. And what you need to make sure is that you're navigating your path so that you have a successful future, and keep in mind that you control that success. Thank you.